In this video, two advocates for boys and men address the audience at a forum about men's health presented by the Washington State Urology Society. This event was held on October 25, 2023 at Temple De Hirsch Sinai in Seattle.
Now I'd like to give you an overview of a campaign for the House Bill 1270. I would like to introduce Joe Cook and Blair Daly. Blair, you have seen, who's the genius behind this. Joe is a manager at Boeing and a volunteer youth leader. Blair coordinates transportation programs for nearby city government. He also founded and leads Washington Initiative for Boys and Men. WIBM is working to build support, both among the public and lawmakers, to establish a state commission on boys and men. Let's welcome Blair and Joe to tell you about this groundbreaking effort.
I'm Blair Daly.
Yeah, and I'm Joe Cook, and I also want to say thank you again, Mr. Rich, for the wonderful introduction, and thank you all for your time here tonight.
So we carry out advocacy for improving the well-being of Washington's boys, male youth, and men. And that includes advocating for the creation of the nation's first state-level commission focused on improving the lives of males. So the proposed commission has 5 focus areas, and one of those is the physical and mental health of boys and men. The one-pager for House Bill 1270 that you were given when you came in, we have more out in the lobby, that lists the other focus areas.
Yeah, so let's take a step back and discuss why we believe advocacy for boys and men is even necessary. First, it's important to understand that there's a range of issues today where boys and men in particular are struggling. For example, we know that males are 77% of the completed suicides in the state of Washington. They're 70% of the unsheltered homeless, 68% of people who die from drug overdoses, 66% of alcohol abuse deaths, 60% of high school dropouts, and 40% of college and university students. And these are just a sample of the numbers that show some real disparities, inequities, and male gender gaps. Whatever we call them, something is going on with our boys and men. Boys and men are half the population, and their problems ultimately impact all of us. Everyone has a son, a dad, a brother, a grandfather, a partner, or a male friend who means a whole lot to them. Due to these disparities and concerns, it makes sense to me that we make it somebody's job to be concerned with improving the well-being of our male population. Wouldn't it be great for policymakers to have a group of people they could turn to who have credibility and expertise on the needs and problems of our boys and men? That is exactly what a Washington State Commission on Boys and Men could offer.
And a bill is already introduced in Olympia that would create such a commission. It's House Bill 1270. It didn't get a hearing last legislative session. We're hoping for a better outcome coming up in January 2024. 7 legislators have signed on as sponsors of the bill. Their names are listed on the one-pager, but they include 3 men and 4 women, 3 Democrats, 4 Republicans. They represent rural, urban, and suburban districts, and they're some of the youngest in the legislature and some of the most senior. We are both constituents of Representative Amy Wallen, and she is one of the co-sponsors. Not only have 7 members of the House of Representatives signed their name to the House bill, but there will be a companion bill introduced in the Senate this upcoming session by a member of the majority party.
And so a scholar named Richard Reeves, who published a book last year called Why the Modern Male is Struggling, Why It Matters, and What to Do About It, we actually have some copies available for those who are interested and want to learn more about that up front. He actually, in that book, when he was with the Brookings Institution, but later this year actually launched a new think tank called the American Institute for Boys and Men. They're actually hosting their first ever event here in Washington coming up November 14th, and we'd love to see some of you guys come out and support that. I want to quote something he states there. Richard points out that we cannot leave a vacuum by neglecting boys and men's issues. If there are real problems in a society and responsible people don't acknowledge and address them, irresponsible people will exploit them. We're already seeing that happen.
So how can you help us? For starters, our website, waboysandmen.org, and our contact info are on the slide and at the bottom of the one-pager. Please contact us, and we'll guide you with some options for how you can help advocate. Also, join our email list, which you can do on the website. Another idea, there's a growing list of nonprofit organizations that have publicly endorsed creating a commission on boys and men. They include the Washington State Urology Society, the Family Jewels Foundation, and several other men's health organizations, both locally and nationally. Also, suicide prevention groups, labor unions, and fatherhood organizations that provide services and training to dads. So if you're connected to an organization that could be a good fit for expressing support for this cause, see if you can help us get their permission to add that organization's name to the list of those that are endorsing the bill. Nonprofit groups, by the way, that have 501c3 status are allowed to endorse legislation with certain limits. You can also help with direct outreach to legislators, so that typically means emailing them. It could also mean asking for a meeting with them. And when you do so, you could bring in Joe or me or one of our other advocacy partners to that meeting. I'll share a couple names of specific legislators who are in really important positions when it comes to this particular bill. They are each the chair of a committee that needs to give a hearing to the bill for it to have a chance of passing. First is House Representative Bill Ramos, whose district includes Issaquah, Maple Valley, and Snoqualmie, and the other is Senator Sam Hunt, who represents Olympia, Lacey, and Tumwater.
And so I also want to be clear, there definitely are government agencies and many nonprofit organizations that provide practical help to boys and men. But the statistics on outcomes for males aren't really getting any better. Often what we're doing is addressing the symptoms of boys and men's problems. Some of these symptoms are harmful not just to the individuals themselves, but to other people too. But we need to look more carefully and with true curiosity and open-mindedness at the causes of these problems. A commission on boys and men could do just that. Social movements and advocacy movements have a history of leaving out certain voices. That's one of the reasons why I'm so involved here with Blair at these early stages, to make sure all men are represented and their voices are heard on these type of issues. Some people say to us, a government commission focused on boys and men's problems, that'll never happen. Others look at the statistics and wonder why hasn't that happened yet. We ask for your help advocating. Thank you.
Thank you.